a robot today, but we are using any form of technology in our surgery for many years now. And any technology can have a technical error, agreed. But in my experience, and I will ask my colleagues here, I have been doing this robotic surgery since 2012 at Apollo Jubilee. I've never faced any technical problem. It's such a robust and dependable technology. So I'll ask Dr. Tony from UK if he had ever, Dr. Anshu from Mumbai and the rest to say if they had any, and once in a while it can happen. But there is very good support system from the companies who deal with these instruments, and they respond immediately and we can help. Anybody has anything to say? Dr. Tony.
Thanks so much. So, no, you're right. It's the robot, like Ruma and my colleague just said, it's an instrument, you know. So we've been doing keyhole surgery for a while. The first laparoscopic hysterectomy was done in 1989. Yet it depends where you live, and even within the same country, which area you live, you could still have open procedure. Why? There were challenges, you know, with keyhole surgery ergonomy, and this is where the robotic platform, all it is a laparoscope, but from the surgeon point of view, you're ergonomically well seated, you know, because we know from the evidence, the longer the procedure, the more tired the surgeon. This is where you start making mistakes, you know. So if you're sitting comfortably, and I'm not saying the robot just to benefit to the surgeon to sit, but more complex, long procedures, you know, you'll do less mistakes. The robot is nothing different than another instrument. The surgeon has to be trained, like your colleagues saying there very rightly so. It is an instrument, but it's a massive instrument. So if you don't use it well, you could do harm more than a small instrument, you know. So you have to learn about how to use your instrument, and you need to learn how to troubleshoot if problems occurs, and sometimes they do. Like Ruma said, it's a machine, you know. You go buy a toaster, you know, and sometimes it doesn't work. Hair dryer doesn't work, but you learn. Robotic surgery is very safe. It's more safer than standard laparoscopy. Why? Because things do happen, not necessarily from the machine, but from your assistant. So if I'm doing an operation, complex operation, my assistant holding the camera, but he or she fainted, they take the instrument with them. If they're holding on to something, they'll pull it with them. If I'm operating and I have a massive heart attack, and I'm holding to something, will tear the patients. But the robotic platform doesn't. So you sit in certainly in one of the robotic platform, you know, there's lots of, and we'll talk about costs in a minute. You sit in, you have to put your eyes in a visor, you're deep into the patient, as if you're inside the patient's abdomen. The moment you take your eyes off the visor, everything stops in the patient. And this is very safe. Now, that means if I had a heart attack sitting on the console, the patient, no harm will happen to them. Does it make sense? Now, you might say, you might have electricity. This could be common, it depends where you live. The electricity go off. What will happen? Everything inside the patient will stay still, so it's very safe. Other not very common, sometimes one of the arms start not working as properly. We've been trained, if that happened, how to remove the instrument safely, move the arm. The robot has 4 arms, so as humans we have 2 arms when we operate, and we have another colleague, you know, to help us. Here you have an extra arm, then you could disable that arm, continue surgery. Any harm happened to a patient while I'm doing robotic, I've been doing since December 14, so I've done 700 complex procedure. Touch wood, no, never, you know. But you're right, so coming back to training, this is very important. We were just discussing as we come in the taxi now, you need to invest in your surgeons, and in order for them to become better, they need to do more. Like everything in life, you know, the more you do, the better you become. But investing from the start is very important, because the worst thing, if somebody using a tool, like say, if I'm used to drive a Fiat Lada, maximum speed maybe like 80 miles an hour, and all of a sudden you put me in a Ferrari, I put my foot, whoa! I need to know, you know, you need to know your instrument. And the robot, all it is, it's an instrument. Coming to the cost, just to add to my colleagues, cost will come down with time, and cost is a relative question. The cost to who? Are we talking about the whole country? Of course, like Ruma said, if the patient, and Roma, if the patients had their operation today and went home 4 hours later, major surgery through little holes, then the more you do operations, you could argue that the cost is cheaper than open or the standard step laparoscopy because you use less instruments, you finish quicker. Then you take the cost to the family house. Then you don't need a babysitter for 3 days. Then you take the cost to work. The patient doesn't have to be paid for 6, 8, 10 weeks as she's recovered, So take it to the economy. Patients going back and contributing to the society, and then, so cost is very relative. And then this used to be a myth, 2 myths in robotic surgery. 1 is very expensive. And second, it takes time, to do the operation. And nowadays they're myth, because now the technology is evolved, but also the surgeons has evolved. They master the technique, so they're much quicker than the standard laparoscopy, So that's it. I cannot think of anything else, goes wrong, But you're right, it's an instrument. You could get default, like from manufacturer default, you could get, but as long as you know your instrument and how troubleshoot it, that shouldn't impact on the patient at all, So, yeah.
Thank you, Dr. Tony. Any other questions? Yes.
What type of guiding problems are increased in humans? What is the cause of in India?
Okay. Anybody else wants to take? Anshul, you want to take that question? Yeah.
I think with the current trend of lifestyle and everything, we've seen patients who have higher incidence of polycystic ovaries, high estrogen, so more amount of fibroids and endometriosis. Also, the incidence of cancers, I think, are increasing in the women's population. Our detection rates have also increased, so more and more patients are getting detected earlier. So all these 3 fields, whether it's fibroids, endometriosis or cancers, robot-assisted surgery actually gives a better outcome to the patient.